Thank you very much, Mr. Chairman. Ms. McPeak, I wanted to ask you to expand a little bit on your opening comments in which you talked about predicting last year that your marketplaces were on the verge of collapse, and as you testified today, they have not collapsed during that time. And I guess it speaks to a worry that I have about how the rhetoric gets overheated with respect to the stability of these exchanges and the overall stability of the Affordable Care Act. I'm so appreciative of the process that both Senator Alexander and Senator Murray have begun, and I acknowledge the fact that we need to make some changes the Democrats want and changes that Republicans want in order to provide some certainty. But maybe you can talk a little bit about what happened over the last year. You said that you were on the verge of collapse. You didn't collapse. And what does that say about how these marketplaces are and have been holding together? Just tell us a little bit about that story.
Thank you. Well, certainly I'm very grateful that the market, in fact, in Tennessee has not collapsed, but I would still say that we're on the verge of being in a very difficult situation and probably still on the verge of collapse. What we have experienced is carriers fleeing the market year over year. We did have one of our 9 rating areas that didn't have any options when Humana decided to withdraw from the exchange earlier this year. We did, in fact, receive coverage for that area through one of our other carriers, but still 78 of 95 counties having one option on the exchange is not a place where I like to be. We need to have a competitive environment so that our consumers actually have choice and we can do something to address premium rates. When you have one insurer that is threatening to pull out of rating areas, it's very, very difficult to really challenge the rate increase requests that we are receiving on a lot of different factors, because the worst possible situation would be for a carrier to flee the market and our consumers not have any choice in the market. And we are still very much concerned about that possibility until the QHP contracts are signed at the end of this month by the carriers.
All right, thank you. Yeah, and I just think it's a caution for everybody to be a little careful about how fast we declare that the sky is falling here. The popular phrase is death spiral, and yet during a period of time that we've been debating the bill, there have been less and fewer bear counties rather than more. So I appreciate that explanation. Mr. Creedler, I wanted to talk to you about the importance of advertising and marketing. I think Senator Baldwin raised this question, but you're an interesting state because you've got pretty much every type of population that exists, rural communities, suburban communities, communities with easy access to information resources, places where it's a little bit hard to get the word out. There's a study out of Kentucky that looks at what happened when the marketing efforts effectively stopped. You had a Democratic governor who was doing robust marketing, and then the new Republican governor has effectively shut down funding for ACA advertising. And what happened there was that there were 450,000 fewer page views per week on the website for the state marketplace. There were 20,000 fewer unique visitors per week to the website. And guess what? ACA enrollment fell by 100,000 people to 94,000 people in 2016 to now 81,000 people. So there seems to be a pretty direct correlation between telling people that these options exist and people actually going and taking a look at the information that would lead them to get coverage. That speaks to what's happening right now with a 90% reduction in federal funding. So I just would love to hear you talk about how you communicate effectively and how instrumental those communications are in making effective marketplaces that insurers want to be a part of.
Senator, actually, we saw an increase in the number of people who were signing up through our health insurance exchange. Even while the federal exchanges were showing a slight decrease, we were actually showing an increase. And I think part of that is that we do have a very active website through our health insurance exchange. It makes it very convenient and easy for people to go there and shop. It was not as robust an increase as we had anticipated, and that really is because of the effect that you have when they're doing it on a national basis, the kind of sharing of information and strategies going forward that really assist us a great deal and help to address the issues around language, which are a particular issue for many of us. And I think that's where we can really make a difference from the standpoint of getting people to sign up for health insurance. If you have that kind of outreach out there, it helps to offset the enforcement of the individual mandate. Though I'd argue quite strongly that you need an individual mandate that's effective. If it's not the one we have now, then you got to come up with something that's comparable.
I support the chairman's goal of getting a narrow package that can pass quickly, but I hope that we do include in our discussion this dramatic reduction in advertising and marketing funding, which I think does have a fairly dispositive effect on the health of these exchanges. Thank you, Mr. Chairman.
Thank you.